friends, for our next session, we would like to have Dr. Vaibhav Kulkarni, Board Member HADSA, Ms. Sheryl Salis, Founder and Director, Nurture Health Solution, Mr. Vishvajit Karandikar, Business Unit Head, Parenteral Nutrition, Fresenius, Kabi, India. They will take us through the session on impact of nutrition literacy on consumer behavior and role of industry.
Okay, good afternoon, good evening, everyone. This is Dr. Vaibhav, board member for HADSA and secretary. Let me introduce you to this organization whom I am leading as a secretary. The Health, Food and Dietary Supplement Association is the apex not-for-profit association founded in April 2002 to be the voice of health foods and dietary supplements. It is popularly called as HADSA. It is not HADSA, it is HADSA. HADSA is the corporate member of International Alliance of Dietary Food Supplement Association, which is IADSA, an alliance of more than 60 dietary supplement associations spread over 6 continents. Its task is to represent the views of the industry in the shaping of global policies and regulations that affect dietary supplements. HADSA's mission is to develop, help, and guide the nutraceutical and food industry, academia, and government initiatives. HADSA also promotes science through health, safe, and quality products that increases the share in the global market for such products. Today, HADSA will be discussing and highlighting the most important topic of the time, because when you see the topic, impact of nutrition literacy on consumer behavior and role of industry. Now, I would like to put a couple of points on this topic. I've never seen such a huge change in the consumer behavior as fast as it has happened in the last 2 years. 2 years back, the way the consumer was behaving or purchasing the products, it has gone a sea change today. And that's why you can see the people or the manufacturers, or what we call in India as a food business operators, they are being pushed by this consumer demand of providing them nutritious food. People have become real cautious, health cautious, and now India is in the headlines with nutrition issues increasingly occupying the Indian headlines. The need for innovation is greater than ever before. Today, the challenge of India is not availability, food availability, but it is on accessibility of safe and healthy food and diets. So to address these kind of challenges, food and beverage manufacturers need to play a key role in India. Consumers as well as investors also are becoming more aware of these risks and opportunities in this sector. As you know, friends, Indian food and beverage industry is the 6th largest in the world. In the coming years, leveraging this power of this market will be vital for tackling the mounting and acute nutrition issues we are facing globally and in Indian context. In both emerging and developing markets, there is a general trend among consumers to, as we see, as I said, there's a sea change happening in the last 2 years. In the behavior, the consumers are looking at or going away from less healthy products, and there's a greater demand for healthier option. Hence, companies faces a huge task to facilitate the consumer demand and this trend and invest more in making nutritious products that are both healthy and affordable. Friends, as you know, a wide range of policies, regulations, taxes, and other measures are aimed at reducing consumer exposure and consumption and increasing the consumption of healthier products. The most important thing that, it was introduced, as you know, Eat Right moment. So these all kind of moments are there to increase the awareness of healthy products or eating healthy. So failure to act on these kind of nutrition can also result in companies' reputation getting tarnished. Public and media awareness, as you know, there is a risk associated with it. If you don't manufacture the good products, you can have a bad media. You can have you will be shown, your image will be tarnished, making your company as an unhealthy manufacturer of the products. So friends, looking at all these things, what I tried to pin down, I think this becomes a very vital subject at the end of the day, where consumer behaviors needs to be looked into, needs to be assessed for any companies to really move ahead and really make a mark in this market. Having said that, let me I would like to end my short discussion here, and this entire session is devoted on this, and I have two excellent speakers with me. First one is Miss Sheryl Salis, who's the founder of Nurture Health Solutions, and second is Vishvajit Karandikar, who's the business head for Parenteral Nutrition Division, Fresenius Kabi. They both are going to give us the insights from a consumer, from a medical point of view, as well as from the industry point of view. So over to you, Sheryl.
So much, Dr. Vaibhav, for that kind introduction. And I'm going to start my talk. I'm actually going to discuss expectations of a consumer from the industry from a healthcare professional's point of view. And in my session, I'm going to actually give you a bird's eye view of what we as healthcare professionals see when we interact with our patients, clients, etc. I'm sure you will agree with me that we have changed from a primitive hunter-gatherer caveman to a sophisticated modern man today. And with that comes a lot of, non-communicable diseases, which we see are on the rise, and diabetes, hypertension, dyslipidemia, cancer. And we're also seeing increasing incidences of PCOS, which is polycystic ovary syndrome, as well as hypothyroidism, especially in women today. Now, obesity is definitely on the rise, with more and more Indians becoming obese. And I think the pandemic has increased these numbers even more. And we all know that Indians are thin, fat people. We look thin, but we have a lot of body fat, which is actually leading to all these NCDs. And we also are sarcopenic. Now, what is even a bigger concern today is that India has the second highest number of obese children in the world. And in our clinical practice, especially during the pandemic, we're seeing that these numbers are going up, with more and more children becoming obese. And we're also seeing more and more children with type 2 diabetes in our clinic today. Is because of lack of physical activity. They're at home, they are bored, there's a lot of eating, there's a lot of unhealthy eating that is happening. And because of the obesity, and we know that the obesity is the mother of all diseases, leading to a lot of non-communicable diseases. Now, if you look at diabetes, we are second to China in the number of people with diabetes in the world, where 1 in 6 adults with diabetes are from India. And what is even more alarming is that we have a large number of people with pre-diabetes in our country, not only adults, but even adolescents and young children. And therefore, we have to really look at this. And, again, the reason for the number of people with diabetes going up is unhealthy lifestyle, coupled with unhealthy eating, no physical activity, stress, improper sleep, etc. Now, while we're talking about NCTs, we're talking about obesity, we're talking about diabetes, we're talking about cardiovascular disease, high cholesterol levels, etc. We have a large number of our population who's also malnourished. Undernutrition remains a very big concern in our country with children, the children affected with stunting. Some of them have wasting, or they're not getting adequate nutrition. And again, in the pandemic, because they're not able to go to school, no access to midday meals. The number of cases of undernutrition is only going up. Pregnant women, we're seeing a lot of anemia in them, and even in young girls. Now, while we're also talking about this today, because there's this whole peer pressure of wanting to look slim, size 0 is in vogue. People are looking up for different diets online. And even if you check online, there are so many new diets which are mushrooming. And as a result of which people are succumbing to these diets, and therefore, again, leading to nutritional deficiencies, because when they do these diets, without consulting a qualified nutritionist, they often delete a lot of food groups, and eliminating a lot of food groups result in nutritional deficiencies, and as a result of which malnutrition. And therefore, we in India are facing a dual burden where there is malnutrition because of not eating the right kind of food, because of poor diet diversity, because of poor nutrient density. Then there's undernutrition because of not getting access to food. And then there is overnutrition because we're eating a lot of food, we're not spending enough, resulting in obesity and NCDs. Anemia remains a big concern, and we've seen that young girls and adolescents have low hemoglobin levels. And this is definitely a matter of concern and needs to be addressed. Now, while we're talking about nutritional insecurity and nutrition gap, there's a hidden hunger that is seen. Quantity versus quality. I mean, we are eating more, but are we eating the right quality foods? Lack of protein and micronutrients, especially iron, iodine, zinc, and vitamin A. And even if there is availability, are we able to absorb these nutrients? Are we cooking the food right? And therefore, there's this whole concept of farm to fork. There's another concept which is talking about 1,000 days of life, right from the time the woman gets to know that she's pregnant till the child is 2 years old. Nutrition plays a very, very important role. Now, when we're looking at health, I know everybody talks about health, but when it comes to food, we all like tasty food, and therefore taste takes over health. And often we've seen, even when health cafes open and, a lot of health foods which are available, people often want to still eat unhealthy food because they are looking at taste. Now, economic growth has led to increased calorie consumption. We're eating much more, we're spending less, but what we're eating is coming more from your cereals, and protein remains a challenge even today. And if you see again in India, we are protein deficient. In fact, 73% of our Indian diets are deficient in protein. While we think that non-vegetarians must be getting good, adequate protein, the surveys have shown that 91% of vegetarian diets and 85% of non-vegetarian diets are still deficient in protein, because there is no focus on protein. People eat food, people eat, they do not understand what are the foods which have got protein, which have got carbs, or which are fat. And 71% of our Indians have poor muscle health. There's lack of physical activity, especially strength training is not something that people do, coupled with inadequate protein intake. And therefore, again, if you're looking at the kind of protein people are eating, because we're eating more cereals, we're not getting the protein, from good quality sources. And therefore, the focus again has to be on providing good quality protein sources to people. And as I mentioned, people are unaware about protein intake. So there is definitely a gap of protein. And even if you look at this month, we're going to celebrate the Protein Week and the right to protein, and the focus is on plant protein. More and more people becoming vegetarian, more and more people becoming vegan. And therefore, again, there's a demand for more plant protein sources. And again, looking at different sources of protein, which are economical, which are easy to access, and pea protein remains one of the most commonly consumed plant protein sources in the vegetarian or the vegan population. Now, another big concern in our country is snacking. Whether it's your 4 to 5 p.m. snacking, and now in the pandemic, we've seen that people are sleeping late, they are binging on Netflix in the night, and again, looking for unhealthy snacks. And 60% of our Indian consumers snack more than twice a day, and 15% of them are super snackers. They want to eat every few hours, and they will snack on unhealthy food. And the COVID pandemic has only made snacking even more and boosted these figures. People are definitely looking for healthy snack options, which are economical, which are easy to find. And therefore, we have to definitely look at, snacks which are affordable, which are calorie counted, because when they're going to eat a full packet, even if it's healthy, It is going to give them, more calories than what they need to eat. Low in salt, low carb, high protein. Very, very important, especially for the evening snack. It has to be low in carbs and high in protein, high fiber, giving you adequate satiety so that there is no felt need to eat again. Easy to carry and consume, especially if you're traveling to work. People are looking for more savory or chatpata because our Indian palate likes something which is tasty, which is more, tangy, and therefore the snacks have to be more, savory in nature. Also, the need for healthy beverages, because again, this is one place where we see a lacunae that we do not have options, especially if somebody's got diabetes or somebody's got a cardiovascular condition or a heart condition. We do not have enough options when it comes to beverages. Especially if they're eating out or even wanting to have something at a restaurant. This is one place where we always have a challenge, and therefore we're looking at diabetes friendly snacks, cardiac friendly snacks which are low in salt, low in saturated fat. Again, kidney disease is on the rise, and therefore again with people with kidney disease, is there something that we can provide them? Reduce HFSS, which is your high fat, sugar and salt, antioxidant rich, immunity boosting rich, stress busting, mood elevation, looking at fat burners, metabolic boosters. So these are some of the products people ask us, is it available? Again, consumers associate real food with health. They do not want to pop in supplements, or they do not want to pop in any kind of medication. They would rather take the nutrition from real food. And therefore, they want it to be recognizable ingredients, which is something that they understand. Because again, when we're looking at a vegetarian population, how much ever we see that, they are not very open to taking soya products, or sometimes not open to eating mushroom because of their own beliefs. Again, very important, it has to be more and more natural, and they have to have some added nutritional content and functional benefits. Again, the areas where people would like to have more nutrition-based products is eye health, brain health. I think in today's time, again, something to relieve stress and anxiety, especially in the pandemic, we've seen people are getting very anxious. Mental health is becoming a big concern today. Detoxification, anti-inflammatory, and bone health. Immunity is the buzzword. In fact, we have a lot of people who are coming forward asking us, what are the foods which can help me boost immunity? So this is another big area to explore. And impact of COVID has been very, very high on immunity boosting foods. People are looking more for immunity boosting foods. And if you look at even the Google search, antiviral and immunity boosting foods, the search has really been very high. And looking for something more natural, something coming from food, rather than taking some kind of pills or tablets. Again, if you see, when people have, when we interact with our patients and clients, most of them are taking some kind of Chyawanprash, and people with diabetes are looking for sugar-free Chyawanprash. Honey consumption has gone up. Coconut oil consumption has gone up because the Ayush Ministry is again endorsing these products, and people are looking at taking these products. Maternal health nutrition, especially when we're looking at immunity. Maternal people who are, planning to conceive or are pregnant or, lactating, they are definitely looking at immunity boosting foods. Senior citizens are looking for it, and people with diabetes. Now, again, when we're looking at, the natural foods, people are looking for detox drinks, something that they can consume when they're, on a detox diet. They're looking for cardas. There's green superfood. A lot of people actually take something which is green, which is going to give them the essential micronutrients, herbal teas, green coffee, matcha tea, fat burners, metabolic boosters, and something that can help them control their blood glucose levels. Again, which is ingredients which are easily found in the kitchen, which are used as functional foods. Gut health. And today there's a lot of importance given to gut health. You go to any scientific conference, there is a session on gut health, and we say that today gut is the new brain. Gut health is also very important to boost your immune system, because 70% of our immune system exists in our gut. And again, looking at foods, which are your gut healing foods, whether it's prebiotics, probiotics, symbiotics. Again, there's a huge area here to explore and make foods available which are helpful for the gut health. Healthy aging. Today we have more people living longer, and therefore they are looking for, again, foods which are, especially with their health ailments. Alzheimer's is on the rise, diabetes is on the rise, other NCDs are on the rise, and therefore we're looking at foods which are easy to digest, which can be easy to swallow, like, for example, high calcium oats, high energy foods, high protein foods, appetite stimulators, magnesium and zinc rich foods, and memory enhancing foods. Today, a lot of people want to go organic, and there's a huge demand for organic foods, but again, which are easily accessible and affordable. Again, a lot of people have allergies today, either that they test and they have allergies, or they've realized that, gluten doesn't suit them, lactose doesn't suit them. They're looking for caffeine-free products. They're looking for hormone-free products or dairy-free products, especially if they're vegans. They are looking for these kind of products with some kind of functional food which is added to it. So this is another area that we can explore. And there is a felt need here because we're seeing more and more people getting, intolerant to gluten and, having IBS issues. IBD issues are also on the rise. Celiac disease is on the rise. In fact, we used to see celiac only in North India, but today we are also seeing population across the country affected with celiac, maybe because of migration or some other reasons. Fiber is definitely missing in our Indian diets. And if you look at the NI and ICMR 2020 recommendations, they say we should take at least 40 grams of fiber per 2000 calories. And whether we look at our meals today, even if you look at a dinner, in most of the people, especially in the younger generation, we've seen that the dinners have been replaced by snacks. People are usually eating high fat, high carb snacks for dinner, which are very low in fiber and protein. And therefore, again, there's a need of fiber supplements, especially if you want to keep your blood glucose under control, for weight loss, and overall for good health. Mood elevating foods. I think this is something that people are really looking for, because today mental stress has really gone up. Even people who are working from home, the number of hours they're working has gone up. There is no in time, there is no out time. People are working through the night at times, and there's so much of anxiety and stress. So people are looking for foods which are mood elevating foods. And we know that dark chocolate is one of the most commonly consumed mood elevating foods. So we need more and more healthier options as well. Cognitive health. I think, again, we're seeing a lot of people, and today in the information age, we're bombarded with so much of information because of access to social media and so much of information which is out there. And we're looking for nootropics, which are supplements which will help in cognitive function. Every time we're feeling low on energy, people consume coffee, or today you have green coffee in the market. But can we get some other kind of foods which will help to boost your cognitive health? Foods to beat insomnia. This is another big area that we can work on. In fact, we have a lot of people who are, especially again in the pandemic, people who are saying they're not able to get sleep. They go to bed at 11, but they're not able to get sleep till 2, 3 in the morning. Insomnia is becoming a big case of worry, and people are looking for foods. And we as healthcare professionals, sometimes we tell them, take chamomile tea, take nutmeg, take some nuts, walnuts. But however, there is definitely a big need in this area. Microgreens. Again, this is gaining a lot of popularity. In fact, a lot of people, even if you go to restaurants, if you look at chefs, they are using microgreens. People are, growing their own microgreens, but this is something that also can be explored. Deficiency of vitamin D. In fact, there's a very interesting study that done by Dr. V. Mohan and team in South India, where they did a survey on 1,500 people in Chennai, and they saw that 55% of people were vitamin D deficient. And what was even more alarming to note is that people with pre-diabetes, diabetes, and the highest amount of vitamin D deficiency was seen in obese population. And today, again, in the pandemic, where we are mostly at home, we're not moving out because of self-isolation. Again, vitamin D levels are going down, and we're seeing this with all our clients and patients. And again, looking at foods which can give them natural, which are fortified with vitamin D. And therefore, food fortification becomes a big area to explore. And the government has identified 5 vehicles for food fortification, whether it's your oil, rice, wheat flour, salt, and your milk. Now, there's this interesting study which was done by Dr. Urpi and group, where they actually fortified, pearl millet to improve the iron status. Like I mentioned, that iron deficiency anemia is a big, matter of concern, especially in our young adolescents and pregnant women. And therefore, can we fortify either millets or flour to be able to give enough iron, which is in a very good form of bioavailability? Because again, when we look at iron, it has to be bioavailable. This is another big discussion, especially if you go to any diabetes conference, there will definitely be a session on diabetes remission. Today, you have a lot of people talking about diabetes remission. So this is another big, because there was a very interesting study, which is called the DIRECT trial, which actually showed that when you put people on a low calorie diet, as low as 800 calories, you can achieve diabetes remission, not reversal, but you can put diabetes into remission where they do not need any medication or insulin, and they can be, just with lifestyle control. So there's again a big need here. We have meal replacers, which we do recommend our patients, but most of them are like shakes and people want to eat something. So again, whether we're looking at soups, whether we're looking at bars, we are looking at smoothies, maybe we're looking at something savory, like, the Indian palate, we love savory items. So meal replacers is another area that which can be explored, and there's definitely a felt need for meal replacers in the market. Functional foods, again, whether it comes to diabetes, whether it comes to cardiovascular condition, immunity, people want to try something naturally first rather than going and popping pills. And what are the most commonly used functional foods? At least what we prescribe to our patients is methi or fenugreek seeds. You have flax seeds, you have chia seeds, you have apple cider vinegar, you have cinnamon, you have different types of tea, whether it's green tea or chamomile tea. Today you have green coffee, green jackfruit flour. In fact, jackfruit flour is gaining a lot of popularity after the Prime Minister Modi interviewed the person who is manufacturing this flour, and we've really seen a huge demand from people for something like this, or whether it's raw banana flour, which is good for your gut and has resistant starch. There's again seeds, oil seeds, especially pumpkin seeds, sunflower seeds, sesame seeds. So, all this is something that people are looking at, whether it's, available in terms of packets, which can be easily carried, or, which is accessible and affordable. So just to conclude, there's an ocean of opportunity out there. So my food for thought is there's a felt need and demand. We have to look at innovative products, filling the gap, make the healthcare profession. I think this is again very important. There are so many products which are already there in the market, but somehow they do not reach us. We as healthcare professionals do not know about this, these products which are there in the market. So it's very important to somehow reach the healthcare professionals, whether it's a doctor, whether it's a dietitian, to make them aware of these products. Very important is make them affordable and accessible. And this is again the Eat Right, Dr. Weber spoke about it, and this is the Eat Right moment where they're actually talking about aaj se thoda kam. So reduce salt, sugar, and fat in your diet and start from today. So thank you so much for your patient hearing. It was a pleasure speaking to all of you.
So thanks, Sheryl, for a very comprehensive talk. So let me go to some medical nutrition, because she has what she told was the oral nutrition. So let me also discuss something about the medical nutrition part. Yeah. So most of you are from the production side. So let me also tell you what happens to your product when you manufacture a particular product. What happens actually to your product? So let me start with the introduction of medical. What is medical nutrition therapy? Actually, the medical nutrition therapy is an evidence-based, individualized nutrition process meant to help. This term was introduced in 1994 by what is now Academy of Nutrition and Dietetics, the largest organization of registered dietitian, nutritionists, and other food and nutrition professionals in the United States. Now, this is very popular all across the country or across the world. MNT is developed and implemented by an RDN with the approval of the patient's doctor. MNT can be conducted in a hospital or in an outpatient clinic or as a part of telehealth program. So this is very important because everything is very customized. How medical nutrition therapy actually works. MNT instructs the individual how to use their diet to best support their medical conditions. It not only addresses the existing medical conditions, but also attempts to lower the risk of new complications. To start this therapy, the RDN first performs a comprehensive nutrition assessment for an individual. They then develop a nutritional diagnosis, goal, and care plan, as well as specific nutrition interventions to help the person manage or treat their condition. The registered dietitian provides repeated follow-up visits to support the person's behavioral and lifestyle changes. This involves monitoring and evaluating progress as well as any health or medication changes. MNT is also providing a qualified dietitian and can either be prescribed in a hospital or outpatient setting. They start during a hospital admission and continue into an outpatient setting as long as the patient is seen by an RDN. MNT can range in complexity from designing a reduced calorie diet for weight loss to prescribing a high protein diet to promote wound healing for patients with severe burns, etc. Severe cases such for people with cancer, a registered dietitian can recommend tube or intravenous feeding to prevent malnutrition. Duration of MNT, medical nutrition team, varies. Typically, the therapy stays in the place until the initial goal is achieved or the nutrition-related diagnosis is resolved. However, the plan can be adjusted as per the need of how the medical nutrition therapy can help certain conditions. Medical nutrition team can be a very effective component of the overall management plan for a number of common diseases, diabetes, heart disease, cancer, digestive conditions, kidney diseases, etc. Now, these are very, very customized feeds which are given to the patient. This is very important. It should not be given by trial and error method. Every formula, every feed will have a particular composition. Types of medical nutrition therapy. We have the oral nutrition support, which was very comprehensively explained by Sheryl. Then we have the enteral nutrition and we have the parenteral nutrition. What is enteral nutrition or what is enteral feeding? Enteral feeding refers to intake of food via gastrointestinal tract. The GI tract is composed of mouth, esophagus, and intestine. This is so it's a science by itself. Enteral feeding may mean nutrition taken through the mouth or through a tube that goes directly to the stomach or small intestine. The term enteral feeding is most often used to mean the tube feeding. A person on enteral feeds usually has a condition or injury that prevents eating a regular diet by mouth, but their GI tract is still able to function. The very common conditions are the neuro conditions. GI tract is intact, but the patient will not be able to eat properly through his mouth. Being fed through a tube allows them to receive nutrition and keep their GI tract working. Enteral feeding may make up their entire calorific requirement or can be used as a supplement as well. Because if the patient is eating but the calorific goals are not achieved, then he can be given enteral nutrition. When is enteral feeding used? The tube feedings may become necessary when you can't eat enough calories to meet your nutritional needs. This may occur if you physically can't eat or if your calorific requirements are increased beyond your ability to eat. If you can't eat enough, you are at risk for malnutrition, weight loss, and very serious health issues. Because what happens many a time if the patient is not nourished properly, then complications arise, and the patient will not support the first line therapy, that is the antibiotic. Types of enteral feeding, commonly known as NGT, that is the nasogastric tube, starts in the nose and ends in the stomach. We have the orogastric tube. We have the nasoenteric tube, which starts from the nose, will go to the jejunal or to the duodenum. Then we have the oroenteric tube, which goes to the intestine. We have the gastrostomy tubes, which is placed to the skin of the abdomen straight to the stomach. PEG, percutaneous endogastrostomach tube, and the patent tube. Jejunostomy tube is placed through the skin of the abdomen straight into the intestine, which includes the PEG, PEJ, the percutaneous endojejunal tubes. Possible complications of enteral feeding. There are some complications that can occur as a result of enteral feeding. Some of the most commonly include aspiration, which is going into the lungs, feeding syndrome, dangerous electrolyte imbalance that may occur in people who are very malnourished and start receiving enteral feeds, infection of the tube or at the insertion site. There is a possibility of the infection at the site of the insertion, nausea and vomiting that result from the feeds that are too large or fast or from very slow emptying of stomach, skin irritation at the tube insertion site. These There are few complications, and majorly also it is seen as the diarrhea due to the liquid diet or possibly medications. Tube dislodgement. This is a very common complaint when the tube is put into the patient's body. Tube blockage, because the tube lumen is very small, 12 French or 15 French. So if you are pushing the food through that nasogastric or nasojejunal tube, there are chances that the tubes are blocked. And if they are not flushed properly, then the food which has been pushed tries to get accumulated in the tube and further causes complications. Who shouldn't have enteral feeds? The main reason a person wouldn't be able to have enteral feeds if their stomach or intestines are not working properly. Very important thing. Someone with bowel obstruction, blood in their intestine, that is ischemic bowel, commonly called as, or severe intestinal disease such as Crohn's disease. Enteral nutrition, what are the advantages? Very cheap, very simple, fewer complications, for efficient use of nutrients, stimulate intestinal blood flow, maintain GI mucosal barrier, that is prevents the bacterial translocation, reduce gut-associated lymphoid system (GALT), commonly known as, prevents disuse atrophy, reduces septic complications to TPN, avoids TPN-induced immunosuppression, improves healing and recovery, and reduce muscle catabolism. These are very important advantages. There would be some disadvantages also because they are independent risk factor for VAP. Then sinusitis is a very common complication, misplacement into trachea, perforation of esophagus, pharynx, and stomach or bowel. If the tube is pushed very with pressure, there is a chances of perforation. PEG use associated with high 30 days mortality, site infection or abdominal wall infection, or very bowel diarrhea. Outlook, the enteral feeding is often used as a short solution while someone recovers from an illness, injury, or surgery. Most people receiving enteral feeds return to regular eating. There are some situations where enteral feeding is used as a long-term solution, such as for people with movement disorders or children with physical. In some cases, enteral nutrition can be used to prolong life. Someone who's critically ill or an elder patient who can maintain their nutritional needs. The ethics of using enteral feed to prolong life have to be evaluated in each individual. Enteral feeding can seem like challenging adjustment for you or loved ones. Your doctor, nurses, or nutritionist and home health care providers can help make this adjustment a successful one. Now let us come to parenteral nutrition. Suppose the patient is not able to take anything orally. So what do you do? Have parenteral nutrition as well. In some cases, enteral feeding may not be an option. If you are at risk for malnutrition and you don't have the functional GI system, you may need an option called parenteral feeding. Parenteral feeding refers to giving nutrition through a person's veins. You will have a type of venous access device such as a peripherally inserted central catheter, inserted so as to give the liquid nutrition. If this is your supplementary nutrition, it's called peripheral parenteral nutrition, PPN. When you are giving or getting your nutritional requirement through an IV, it's often called as the total parenteral nutrition. So peripheral parenteral nutrition is very easy to understand. It is given through a peripheral vein, and total parenteral nutrition, because it has a very high osmolarity, needs to be given to a central vein, maybe through a jugular vein or something. Parenteral feeding can be a life-saving option in many circumstances. However, it's preferable to use enteral nutrition if at all possible. Enteral nutrition mimics regulating and immune system function. Just to give you an example, we had one patient of parenteral nutrition where he had a short bowel syndrome. He had to be put on parenteral nutrition. He used to take about 4 bags, and he was taking it for more than 25 years or so. So parenteral nutrition is also a life-saving. Advantages: can be started early, very simple, no delay in caloric intake, does not rely on gastric or intestinal function because it is directly absorbed in the bloodstream, less need for interruptions, safe and less need for mechanical ventilation, and better muscle mass if used early. Very important because whenever you are giving enteral nutrition to a patient, you are not sure how much it is absorbed. But when you are giving parenteral nutrition, you are sure that whatever you are giving is absorbed by the body. What are the disadvantages? Catheter related, sepsis, occlusion insertion, hyperglycemia at times, hypercholesteremia because you are giving fats also the central line, abnormalities in LFTs, liver function test, metabolic acidosis, and there is no GFR. Evidence. In last 15 years, what is seen is this is the evolution of nutrition. First, it was total parenteral nutrition, then it was enteral nutrition, and now the latest concept is supplemental parenteral nutrition. Because what is more important is to achieve the target values of the patient. Suppose if you are able to achieve the target values through the enteral nutrition, nothing like that. Suppose the patient's requirement is, let's say, 2000 kilocalories per day. If the patient is only able to take 800 calories, 900 or 1000 calories, but you still need to take up those calorie deficits. So you need to give partial parenteral nutrition. Otherwise, you keep on accumulating the calorific deficit, and at the end of the day or at the end of the treatment, you will see that the patient is still not recovering much faster. Clear reduction in the mortality in patient fed by TPN. Timing of feeding seems to be as important as the route. No difference in 60-day mortality. This is in comparison with enteral nutrition. No difference in ICU or hospital length of stay. Fewer days of mechanical ventilation, less muscle wasting, and less fat loss. This is very important. If the patient comes out or is weaned off from mechanical ventilation, then the recovery is much faster, and ultimately the cost of the treatment comes down. When evidence-based guideline for nutrition is followed, more nutrition was delivered more consistently. Achieved by early introduction and more complete enteral nutrition without any decline in the guideline group fed earlier achieved calorific goal more often. Ultimately, what is more important is the ICU stay should come down, the cost of the treatment should come down, and the patient recovery much faster. So, what is the ultimate goal? So, overview, controversial issue, debate of enteral nutrition versus parenteral nutrition. It should be enteral nutrition and parenteral nutrition, or more commonly nowadays called as supplemental parenteral nutrition. At present, best recommendations are to optimize oral or enteral nutrition, avoid forced starvation if at all possible, consciously use supplemental parenteral nutrition. Feed the malnourished. Tendency to enterally feed first. Simple goals based on the patient size. The thumb rule is 25 kilocalories per kg body weight per day, and the protein requirement is about 1.5 grams per kg per day. If EN delivery fails, that is enteral nutrition delivery fails, use total parenteral nutrition to complement or replace. Control glucose with insulin or give glutamine as well. Observations and recommendations to the industry. We have huge number of companies having commercial diets, and also huge number of research facilities for new concepts of commercial diets. Very few companies sell parenteral nutrition products, and also very less number of research facilities for parenteral nutrition products. We have to always depend on multinational companies for research and development for parenteral nutrition products. We need to have research facilities for parenteral nutrition products. I know this whole conference webinar is for enteral nutrition, but this is a very sincere recommendation from the industry is whenever it comes to parenteral nutrition, we have to always look outside India for the research and development. There are very few companies who have R&D facilities, very few companies who are selling parenteral nutrition products. Because what is more important is we have to give nutrition to the patient. This is from the patient's perspective, whether it is EN, PN, or it is supplemental parenteral nutrition. So thank you so much, and thanks for a very patient read.
Yeah, thank you, Vishvajit, for this very thought-provoking presentation on and explaining this very not so easy concept. See, people feel food is very easy, to study, but when you really look into this more of a medical nutrition, the hospital nutrition, when parental nutrition, then you have got enteral nutrition between, and then how the differences, and what you clearly said that there are very less amount of companies in India who are actually into this parental nutrition. So again, if you it is a matter of it is also an eye opener for some of the Indian entrepreneurs who can actually venture themselves moving ahead, getting into the parental nutrition space rather than looking up to the multinational part. Thank you for your presentation and a sincere, effort to make people understand on the medical nutrition part. Also, on the earlier presentation, Sheryl, I think I need to thank you. You provided a lot of insight on various foods and vis-a-vis the disease condition, which foods we are taking, and how you need to really consult a dietitian or nutritionist before consuming any food, or what we call in pharma is self-medication. So you don't have to do a self-nutrition medication. I will not call it as a medication, but still self-nutrition therapy, where you don't know how much amount of calories going, how much amount of protein is taking, you need to take. And it is more of and I know there is now personalized nutrition which is coming up in the Western world, which is shortly it will land up in India as well, some point on it. So I think both of you had given different point of view, and really I know that people who are listening to you today may have really got enlightened with a lot of stuff from a consumer, from a medical, from a various area point of view. So thank you both for giving this very crisp and nice presentation. Over to you, Samir.